This is Dr. Martin, and I'm going to go over the pre-operative instructions for your surgery. This video will give you instructions to prepare yourself for surgery and will be divided into 3 sections: how to prepare yourself for surgery, rules for undergoing anesthesia, and medications prescribed. How to prepare yourself for surgery. We recommend you wear loose-fitting, comfortable clothing. A short-sleeve shirt will allow us to take your blood pressure and apply appropriate monitors. Avoid colored nail polish since it interferes with our oxygen monitoring devices. Brush your teeth before your appointment. This will help reduce the number of bacteria in your mouth and lower your chance of having a post-operative infection. Do not smoke or drink alcoholic beverages for at least 24 hours prior to your surgery. If you're an asthmatic patient and use an inhaler, please bring your inhaler with you. We will most likely have you use your inhaler prior to anesthesia. If you're currently taking any medications prescribed by another physician, you may go ahead and take those medications the day of surgery, but only with a small sip of water. Finally, please arrive 15 minutes prior to your scheduled appointment. Rules for undergoing anesthesia. Because general anesthesia relaxes the smooth muscles in your digestive tract and your airway, we need to ensure that food does not pass from your stomach into your lungs. Therefore, if you have been scheduled to undergo anesthesia for your surgery, it is essential that you do not have anything to eat 8 hours prior to your surgery. This means at midnight the night before your surgery, you should stop eating. The only exception to this rule is that you may have clear water up to 4 hours prior to your surgery. You will be given further information in your packet with your specific times when to stop eating and drinking. Secondly, please bring a responsible adult with you to your surgery. They will need to wait for you during your surgery and be able to drive you home. For several hours after anesthesia, you will feel groggy and disoriented and will not be able to drive. Medications prescribed. Most patients are prescribed medications prior to surgery. Please pick up these medicines well in advance of your surgical date. 2 of these medications, the pain medication and the antibiotic, will be taken after the completion of your surgery as they are prescribed on the bottle. The 3rd medicine prescribed is a Medrol dose pack, and it is to help with swelling. If you look at your Medrol dose pack, I will explain how it is to be used. This is the Medrol dose pack. This is a short-acting steroid to help with swelling. It reduces the initial swelling that you have, and it will limit how many days you will be swollen for. It's imperative to start this medicine 1 day prior to your surgical date. If you look at the medication packet, there's 6 lines for 6 days. Day number 1, you take a whole bunch of pills, and day number 6, you only take 1 pill. It'll say underneath the pills when to take that medicine. Once again, we start this medication the day before surgery. So day number 1 is the first line. Day number 2 is the day of your surgery. If you're scheduled in the morning hours, we skip the breakfast dose, we add it to the lunch dose, add it to the dinner dose, or add it to the nighttime dose. If you're scheduled later in the afternoon, take your breakfast dose with your breakfast, skip the lunch dose, and then take that either at the dinner dose or the nighttime dose. Then take days 3 through 6 as prescribed. If you have any questions regarding any of the information received during these videos or in the instructional paperwork that you received at the office, please feel free to call us. Also, additional information can be found on our website, arizonaoralsurgery.com. Thank you for your time, and we look forward to seeing you and providing your surgical care.